Introduction. Coffee is one of the most widely consumed beverages globally, known for its stimulating effects due to its high caffeine content. Caffeine acts as a central nervous system stimulant, promoting alertness and reducing fatigue. Many individuals enjoy coffee daily for its taste and energizing properties. However, when consumed alongside certain medications, coffee can interact with their effects and absorption, potentially impacting treatment outcomes and health. Mechanism of interaction. The interaction between coffee and medications primarily involves the effects of caffeine on drug metabolism and absorption in the body. Caffeine can influence various enzymes in the liver, specifically cytochrome P450, CYP450 enzymes, which are responsible for metabolizing many medications. Liver enzyme modulation. Caffeine can induce or inhibit CYP450 enzymes depending on the specific enzyme and drug involved. Induction of these enzymes can increase the metabolism and clearance of medications from the body, reducing their effectiveness. Conversely, inhibition can slow down drug metabolism, leading to higher levels of the medication in the bloodstream and potential toxicity. Absorption effects. Coffee, especially when consumed in large quantities, can affect the absorption of certain medications in the gastrointestinal tract. The acidic nature of coffee can alter the pH level in the stomach, potentially affecting the solubility and absorption rates of drugs that require specific pH conditions for optimal uptake. Diuretic effects. Coffee is also known for its diuretic properties, which can increase urine production and affect the elimination of medications excreted through the kidneys. This can alter the concentration and duration of action of some drugs in the body. Health risks and considerations. The interaction between coffee and medications can pose several health risks and considerations. Reduced medication efficacy in cases where coffee accelerates drug metabolism. Medications may be cleared from the body too quickly to exert their intended therapeutic effects. This can lead to suboptimal treatment outcomes and the need for higher doses to achieve therapeutic levels. Increased medication toxicity. On the other hand, inhibition of drug metabolism by coffee can result in elevated drug concentrations in the bloodstream, increasing the risk of adverse effects and toxicity. This is particularly concerning for medications with a narrow therapeutic index, where small changes in blood levels can have significant clinical consequences. Caffeine sensitivity. Individuals who are sensitive to caffeine may experience heightened side effects, such as jitteriness, palpitations, and insomnia, especially when consuming coffee alongside medications that affect the central nervous system or cardiovascular system. Cultural and dietary implications. Coffee consumption is deeply embedded in many cultures and daily routines worldwide. It serves as a social beverage and a morning ritual for millions, often enjoyed with or without meals. However, the cultural significance of coffee consumption should be considered in light of potential interactions with medications and individual health needs. Case studies and statistics. Research and case studies provide insights into specific interactions between coffee and medications. For example, studies have shown that caffeine can affect the metabolism of drugs like clozapine, an antipsychotic, and theophylline, a bronchodilator, altering their therapeutic levels and efficacy. Statistics on adverse drug reactions related to coffee consumption underscore the importance of awareness and monitoring. Healthcare providers routinely educate patients on potential interactions and advise on appropriate coffee consumption practices while on medication. Regulatory and expert opinions. Health regulatory agencies, such as the FDA and European Medicines Agency, EMA, provide guidelines and warnings regarding the interaction between caffeine, found in coffee, and various medications. These agencies emphasize the importance of consulting healthcare providers and reading medication labels for specific instructions on coffee consumption during treatment. Healthcare professionals, including pharmacists and physicians, play a critical role in educating patients about potential interactions and providing personalized recommendations based on individual health profiles and medication regimens. Preventive measures. To mitigate the risks associated with coffee medication interactions, individuals can take several preventive measures. Consult healthcare providers. Discuss coffee consumption habits with healthcare providers before starting new medications. They can provide guidance on whether adjustments in coffee intake or timing are necessary to optimize treatment outcomes. Monitor symptoms and effects. Be vigilant for any changes in symptoms or side effects while consuming coffee and medications concurrently. Report any concerns or adverse reactions to healthcare providers promptly. Read medication labels. Pay attention to medication labels and patient information leaflets for specific instructions regarding coffee consumption. Some medications may recommend avoiding coffee altogether or adjusting intake to minimize interactions. Timing and dosage considerations. Space out the consumption of coffee and medications to reduce the likelihood of interaction. Taking medications with water or other neutral beverages may be advisable if coffee is known to interfere with absorption. Conclusion. In conclusion, while coffee is a popular and enjoyable beverage with potential health benefits, its interaction with medications should be carefully considered. The effects of caffeine on drug metabolism and absorption can impact treatment efficacy and safety. By understanding the mechanisms of interaction, consulting healthcare providers, and adopting preventive measures, individuals can safely integrate coffee consumption into their daily routines while minimizing potential risks to medication therapy and overall health.